Hello Cambodia, my name is Dr. Hin Tran. I'm a general practitioner by trade. I'm the deputy chairperson of AHHA and deputy trip leader. It's now day 3 into our commission in Cambodia, Phnom Penh. I would like to take this opportunity to thank AHHA volunteers. It's been a wonderful group of people. The team bonding, the teamwork is excellent. You can never dream of another team of similar caliber. I also like to thank CISA and the local volunteers, the medical student, the health student that has been helping us in the last 4 days. They've been a wonderful group of young people with lots of energy and enthusiasm in helping the poor people. I also like to thank those organizations who have helped to transport the patient from the rural part of Cambodia, including the Wildlife Organization, who has sponsored and transport the patient here to us to work. And most importantly, I'd like to thank the local Cambodian people, the poor people of Cambodia, who has given us the opportunity to help you, because without you, we cannot do charity work, and I think you deserve a thanks. My last 4 days in Cambodia has been a wonderful period of time, despite the fact I've been here last year. This year has been an enormous effort from everyone, and I really enjoyed working with the local volunteers, the hospital staff, and everybody who I've been bumped into. I love them all.
Hi, I'm Dr. David Warsnop. I'm the head surgeon with the AHHA Charity Cataract Surgery Project. I've been working with this team for 13 years in Vietnam and Cambodia, providing thousands of free cataract operations, other operations and humanitarian work to poor people in those areas. This year we've embarked on a new program operating in the capital, Phnom Penh, and bringing patients from far-flung and difficult to access areas using operating theatres which give us a more modern style and feel and allow us to improve our decade-long aim of providing modern first world cataract surgery to poor people in the third world. In addition to that, we've taught a number of registrars, many medical students, and interacted with other eye doctors here to the extent of running an afternoon seminar where we can discuss pros and cons, differences, and learn from each other. On the whole, our patients have been doing very well. I've been leading the post-operative team. The patients happy when they take their iPad off the next day. One man said in English, and many have indicated when we asked them, "Can you see now?" He said, "Well, it's a lot better than yesterday." And that's really what you want to hear.
Hello, my name's Dennis Lowe. I'm from Sydney, Australia, and I'm one of the ophthalmologists, part of the surgical team which has come to Cambodia. I found the whole experience over the last 3 days to be excellent in terms of the facilities that were provided to us by the Cambodian hospital and the government, and also what we brought ourselves to try and maintain and continue a good level of surgical care to the Cambodian people.
Hi there, my name is Dr. Rex Martin. I'm a volunteer from Geelong, Australia. I'm an anaesthetist, and this is my second volunteer trip. First one was to Vietnam, my first time to Cambodia, and my job is to help with numbing the eye prior to surgery. So overall I found it a pretty satisfying experience. It's been really great helping the patients, and I think will make a big difference to their lives. So it's been a very interesting experience for me. Thank you for the opportunity.
Hi, I'm Patrick Wong. I'm coming from Sydney, Australia. My role here in this mission is basically work as a GP, general practitioner doctor, to screen the patient before their operation. This is my second involvement in this kind of work. Relating to eye operation and cataract operation mainly, delivering to underprivileged country like Vietnam, Cambodia. I've been to Vietnam about 3 years ago. This is my second trip and first time in Cambodia. And I find that the people who are organizing this group, are the most caring and loving people and dedicated people. They put in a lot of time when they're preparing for the trip. There are a lot of work to do, including fundraising and also getting all the key people involved in this mission is extremely sort of daunting, a lot of work to do. And here I am, I'm part of the group and I'm very glad to be here. And wish with our help we would like to impart some sort of our expertise to the local professional too, in order to educate them as well and deliver a bit of health education as well to both the public as well as the health professionals as well. So here I am, I would like to do it again if I have a chance.
Hello, my name is Dr. William Trent, the chairman of AHHA, Australian Health Humanity Aid. It's an Australian registered charity organisation, and we have been in Cambodia for the last 5 days, and we've been operating for the last 3 days. So far, we have operated more than 240 cataract surgery and pterygium surgery for the last 3 days. We are very proud of our achievement within a short time. The first day is a bit challenging because we don't know where the patient come from, what type of the cataracts are, and the patient that on the first day they actually come from very far away. What that means is they often receive very little medical attention or treatment, and when they came in, normally their cataract much denser, much difficult to operate. But our doctors and nurses have managed to overcome all these difficulties and challenges. So we really appreciate our nurses and surgeons understand the situation, and they're very happy that continue to improve how we go to change the way we do things. And also we're very happy that we have medical students and local doctors attending our theatres and to learn some from our surgeons the new techniques. So we hopefully that after we leave, the local medical student and local doctors can bring the same care, the same technology to the local Cambodian people. Once again, on behalf of AHHA, I would like to thank everyone involved, the Cambodian people and our volunteers. Thank you.
Hi, my name's Alison Chong. I'm a volunteer for AHHA from Melbourne. I've been doing these trips for 9 years now, since 2008. I come back every year because I love the experience, I love the people, It's like a second family to me. I feel like I'm missing out if I don't come. The experience for me is something special because I feel that this is what we're trained for, and it's really nice to be able to give back to other people that can't afford it or don't have access to it themselves. So it's a very humbling experience for me, and I know it is for the rest of the team as well. This experience in Cambodia this time has been incredible. We've noticed how poor and how disadvantaged the patients are and how much they need our help, so it's really nice to be able to do that. The staff in the hospital here, the local volunteers have been amazing and made us feel really welcome and have been overwhelmingly kind to all of us. We're really pleased to be here. We can't wait to do some more work next week and help as many patients as we can. I'd like to thank everybody from my team, from the surgical team, the dental team, orthotic team from Australia, and the local volunteers as well. It's been amazing. Thank you.
ខ្ញុំមកពីខេត្តកំពង់ឆ្នាំងហើយមកបកភ្នែកនេះហើយខ្ញុំឈ្មោះឌុកផុនអាយុ63ឆ្នាំពរឲ្យគ្រូពេទ្យនឹងបានសេចក្តីសុខអាយុវែងបានជួយឲ្យខ្ញុំភ្លឺនឹងដំណរអរគុណអូយខ្លាំងណាស់បានសុខបានចម្រើនទាំងអស់គ្នាខ្ញុំបាទរស់នៅភូមិដូនប៉ែនខំបឹងស្រុកបរាយខេត្តកំពង់ធំហើយខ្ញុំអាយុ59ឆ្នាំបានមកបកផ្នែកនៅដួលនៅពេទ្យសូមអរគុណលោកគ្រូពេទ្យណាសូមថ្លែងអំណរអរគុណណា
Hi, I'm Teresa De Leon. I'm Kim Phuma's widow, Kim Phuma was one of the co-founders of CISA, and I've taken his place on the CISA board of directors. Kim Phuma worked extensively in Cambodia over many years, doing eye surgery in the remote and regional parts of Cambodia, doing eye surgery on the Cambodian poor. After his experiences, he had a vision that he'd been working with Sean to set up a centralized operating facilities here in Phnom Penh that would then provide a much better operating conditions for the surgical team, and that would result in better patient outcomes. And from the bottom of my heart, I would like to thank the AHHA team because they have actually made that vision come true. Part of his vision was strongly focused on education because he believed that legacy is going to be a lasting one. By having one of the collateral benefits of having a centralized operating facilities is that there are doctors, local doctors, medical students and nurses that are around who can volunteer or who can be taught when we're actually doing missions, and that has been proven to be quite effective because from day 2 we've actually seen that in action, where we've had the medical students being able to give post-op instructions, being able to give anesthetic blocks. So that is an important part of the legacy that we have to leave. The other legacy that Kim wanted to leave was to train local Cambodian ophthalmologists and send them and have a clinical scholarship to Australia or somewhere overseas to work with leading ophthalmologists. And they can bring this knowledge back to Cambodia, which will then, and they will be the next generation teachers. Because at the moment we have subspecialties that they may not have had experience in. And we have, in his memory, we've set up the Kim Phuma Clinical Training Scholarship Appeal. And we have enough funds now to be able to fund one local Cambodian ophthalmologist to do clinical training in Australia next year. Part of this education legacy, AHHA and CISA have organized an inaugural conference where about 100 local ophthalmologists from Cambodia will be attending a conference with 7 Australian ophthalmologists and to share their learnings. From the bottom of my heart, I'd like to thank you all for working with CISA and achieving Kim's vision. And it's been a very good experience, and I've seen really good feedback from the patients who feel so grateful for the work that you've done. I've seen the well-oiled machine that AHHA organization is, and more importantly for me, the positive feedback from the surgical team that this is the right thing to do. Thank you.
Everybody, my name is Sean. I'm the co-founder of CISA with Dr. Kim Furuma from Sydney. Dr. Kim and I have worked extremely hard over the last few years trying to establish a centre here based in Phnom Penh to allow free surgeries for the poor communities living in really remote and village areas of the kingdom. Unfortunately, Kim's not here with us today, but I'm sure he's here with us in spirit. The most important thing I would like to say is this. What you've done and what you've been doing here in the last week, providing these medical services and especially eye surgeries for the people, is just amazing. You can see these people that come over here travelling like 600-700 kilometres from where they live just to come to have a chance of a surgery which can give them sight. So what you guys have done, the team of AHHA, also the team of CISA as well, and all the volunteers locally and international, you've given us the gift of sight. And I just want to say a big thank you to Dr. William, who's the chairman of AHHA, who's spent many hours on the phone at very late nights with me and organising his whole team, from surgeons to medical staff to optometrists, to volunteers as well, fundraising and providing all the services and supplies, medical equipment to come here. So on behalf of all the patients, the families that you've touched by your services to give them sight, I'd like to say thank you very much, Okun, and please enjoy your night and have a safe trip back. Thank you.
Mm-hmm.